December the 1st marks the 30th anniversary of World AIDS Day. Launched in 1988, the annual observance highlights worldwide efforts to combat HIV/AIDS. World AIDS Day is also an occasion to show support for those living with HIV and to remember those who have died from the infection. Now, this year's theme is tagged Know Your Status. For more on this, I have with me in the studio Dr. Latifatu Adelaye from the Lagos State Ministry of Health. Thank you for joining us.
Thank you very much.
Now, let's start with you telling us how the Lagos State government, the strategies it's putting in place to ensure that about 90% of the people know their status. Looking at UNAIDS demand that by the year 2020, about 90% of the people should know their status.
Okay. Thank you very much for the opportunity. Currently, the Lagos State government is actively in the community and within the facilities, because we're trying to look at it that how do we reach people, and we have what we call the mobile testing vans that go around to test people. The government itself had also procured a lot of test kits in which are being used within the facilities and the community to ensure that we reach that 90%. The government on its own also, as part of the national mandate, is encouraging people on the self-testing. So in which you are encouraged, you can actually test yourself at home, and that advocacy is ongoing. The government is actively and well on ground trying to reach as many people as we can.
Can you give us statistics?
No, I can't give statistics right now because usually our statistics are gathered at the end of the year and stuff, so we're still on that. So I won't be able to give you precisely what I said, but I can tell you currently the government is actively trying to reach 90% of the people that are HIV positive to know their status.
Okay, now tell us about treatment subsidy. Are the people living with HIV getting enough antiretroviral drugs? Are they coming up, or is the state government coming up with enough drugs for them?
As a state official working in HIV, what I know is that the antiretroviral drugs are free and they are available in 61. We have what we call the comprehensive sites. That's where we give treatment to both men, women, and children. We have 61 facilities, which includes all our secondary care facilities, some key primary health care facilities in the state, and private facilities offering these drugs free to anybody that is being tested and is positive.
So it's not a subsidy?
It's not a subsidy. You're not paying a subsidy. No. Once you tested and you are tested, the next thing is to cancel you and make sure that there will be adherence, because that's another very important part, and then you're placed on the medication, on the ARVs.
Okay, so how about enlightenment in terms of programs, initiatives that the state has come up with?
Okay, the state is working actively. The state has an agency which calls Lagos State AIDS Control Agency, which works with a lot of other non-governmental organizations, a lot of implementing partners, the donor partners. They're talking about UN, UNICEF. So the funds are diverse in different ways, in TV houses, in journal homes, educating and trying to tell people to come out to be tested. The advocacy is done in local languages, okay? It's also done in linguals, but it's not enough. I have to be honest with you, because I believe you and I as well are also advocates, and we need to sensitize people. There's a question I usually ask people: how many people in your house have gotten tested? So if we have 100%, that means we've done our job. So I implore people to make sure that everybody around you gets tested. There's no need to worry so much about the stigma. The government has rules and policies to protect anybody against any stigma. Yes, the
Tell
policies.
us about these policies.
The policies are being coordinated by the Lagos State AIDS Control Agency with the Lagos State Ministry of Justice. So in case if someone is tested positive and has a problem at work, the person can report to the agency, and then with the Ministry of Justice, it will be handled by the state. So the state is very much aware of the vices against that. So the state is encouraging people to come out. Now once you come out and you're positive and you're tested and you're positive, you're placed on medication, you tend to live long life.
Has there been cases that of such stigmatizing that the state government has handled that
There's
you can
several
tell?
cases. I cannot say precisely one, but I know that several that the state has handled, and the individuals are doing very well.
Okay, now let's look at going into the grassroots, who these people do not have access to television, do not have access to radio, and do not have access to possibly phones that can actually browse. What measures are being taken to ensure that they are enlightened in this aspect?
As in Lagos State, we have a lot of CBOs, we call them civil society organizations, that are a coalition of them that we have within the community, in which within those communities they have diverse methods and ways in which they sensitize them. Some of them is engaging the community leaders, engaging the youths in the community at every random opportunity. During our usual MNCH week, we go out there to encourage a lot of women, street by street, to come out and get tested, to men to come and test as well with their wives. So there are different strategies that is being employed on the field to encourage people within the community to come out. But like I said, it's never enough.
Of course.
Until we achieve what we're after, then we say, okay, we actually...
Now, still on the path of these rural areas, you know that a lot of these women like to patronize traditional birth attendants. Now, these homes, are they being thought precautionary measures such that can curb mother-to-child transmission?
Thank you very much for asking, because that's one of my very passionate part. In Lagos State is so well structured and organized that you have what they call the Traditional Medicine Board that has all the TBAs encouraged to register. This board coordinates the activities of the TBAs, not just in terms of PMTST, but it's also for reducing maternal and child health. So what they do is that they gather them and give them minimal training and encourage them on their limits. This is what you should do in case if you see a woman like this. So for HIV, what we do is that we have training for them, in which we call orientation. Sometimes we gather them, like Lagos State has a map document of most of the TBAs we have, both registered and unregistered, and then we go training them, telling them what their limits should be. We tell them that they should use what we call the universal precautions. As a health worker, you treat everybody as if everybody is infected, so that you can be able to protect yourself and protect the next client. So that is ongoing. And then there's actively testing in most of the LGAs for the TBAs, in which the state deploys counselor testers to go and test the women that come to those TBAs to seek for their services. And so the positive clients will be taken with the collaboration and the encouragement of the TBA and linked to a site where she will collect her ARVs and placed on PMTST. We also encourage that those women deliver at the facilities. But sometimes when they don't, we encourage that they have a safe delivery and the baby is placed on syrup nevirapine. So the state is actively doing that, and it's working beautifully well. And we hope
and these the activities of the TBAs are being monitored closely.
Closely monitored by the states as much as we can.
All right, Dr. Latifatu Adeleye, Lagos State Minister from the Lagos State Ministry of Health. Thank you for your time on the news.
Thank you very much.